one of the most important components in healthcare delivery is medicine. End of the day, at a critical point, you need to give somebody the medicine he needs to get well. And most times, we don't even know the impact of this. Even most experienced doctors, when treatment fails, they don't even think of medicine quality as a case. Many stories and stories. I want to tell a story. I have a friend. He has refused to remarry. He married, his wife died giving birth. It was a painful experience. He saw the wife bleed to death. So for him, it's like, this is a very tough one. I'm sure all of us here, we have these stories to tell. Yet, it's like, keep ignoring it. Medicine quality is the most important aspect of this, especially in Nigeria. The issue we're having right now is that, a story of oxytocin. 2 years ago, we did a survey of oxytocins in Nigeria, healthcare facilities. We found out that 75% of these medicines are of poor quality, meaning that if a woman walks into a health facility to give birth and she needs oxytocin, which is critical, either she gets it or she dies. She gets it and gets the wrong one, she dies. Every day we hear the stories that Nigeria being among the highest in maternal mortality. Really, my story, what I want to leave us with is really, medicine quality is very, very critical. And yet, very little importance is given to it. A few weeks ago, I was talking with a donor. They are thinking of doing a massive public health intervention, hundreds of millions of dollars in Nigeria. I brought up the issue of medicine quality. It's like an afterthought. I know here we have a lot of policymakers, doctors, many different people, really. I want us to give the importance it deserves. I've been in this space in Nigeria for the past 5 years. And it's, the personal experience I have as a Nigerian and what you see from the point of view of what you do is a very serious matter. Of course, NAFDAC is trying its best. It's doing a lot of improvements. Also, poor quality medicine is a global issue. But in Africa and other developing countries, it is acute. There are two reasons. One is expertise issue. The other one is criminality. At least the lowest hanging fruit is the expertise issue, really. We can solve it. Most people don't have a clue of how medicines are stored. The issue of medicine is that if you have a food that is bad, once you eat it, you know you drop it. If you have a shirt that is bad, once you wear it, you drop it. But medicines, if you don't have a clue of what's going on, you have a lot of confidence you are getting better. Doctors, good doctors, wonderful people, diagnose, start treating you is not working. Not only that, not only for the patient, but for all of us. Antimicrobial resistance is happening like mad. It's like wildfire. The other day I was talking with the NC of a TB program. He was telling me their stories. I told her, have you been checking the quality of medicines? Imagine somebody for months on TB medicine. Imagine a woman that is trying to give birth and he needs this medicine. Really, if we start rethinking, knowing that most of the cases of treatment failure has to be attributed to this, and nobody does it, nobody thinks about it. Once we start thinking about this, we'll see really that it's a huge issue that we should focus on. A lot of investment in healthcare is going to waste. Outcomes are not being there, because at the end of the day, you invest millions of dollars. End of the day, that woman is there to... There's a story that Professor Osagi did not tell. One day, I'm sure most of us know him. He was in the hospital trying to treat a patient. This one was bleeding like crazy. Giving injection, nothing was working. He was challenged. It was really painful for him. He walked down, took his car, drove personally to a particular pharmacy, got oxytocin, came back, and then injected this woman. She lived. This is just this. And most times, how will you know? Of course, the other issue is that there's a lot of criminality really going on. Many people have seen that peddling in narcotics doesn't give you as much money as doing doing fake medicines. You make much more money. It's now a cartel, a global one. It's not just that particular trader in Idumota or Aba or Kanu or Onitsha. No, it's a global cartel. They're shipping cheap loads across the world. 7-8 years ago, I was involved in a project across Africa, tracking medicine quality. I mean, it's so painful to see what is there in the field. I go to a particular country. Every anti-malaria medicine had no active, nothing. Imagine the impact. Imagine even if you don't die, imagine being sick for longer than you should be. So really, my story is simple. As we think of quality in healthcare, let's start thinking of how do we focus on medicine quality. There is the investment we make is being wasted. Of course, the amount of people dying. When I was in University of Lagos, my office was just by children emergency. It was the toughest time of my life. Every day you see young mothers running with their children. Some of them are practically naked, running to go and save the child. End of the day, nobody is thinking of, are you sure that this woman has not been trying to treat the child, but buying the medicine from one vendor there? And then one day, most painful one was, I saw a woman cry for 3 hours, begging God to kill her instead of letting that child die. It was so painful. These are what we face every day. Medicine quality is something that we should all see as a public health emergency. Nobody has done this study, but I feel more people die of poor quality medicines than actually other things, really. Because that confidence a doctor has, that confidence, and also what is happening now, that people are losing confidence in healthcare system. I go to the doctor, I have malaria for 3 months, I'm in treating it, really. So, of course, if we lose confidence in our doctors, we are going nowhere, really, the healthcare system. It doesn't matter where you get the medicines from. A strong contributor to the quality of medicine is storage and distribution. A strong contribution, really. You don't have confidence because it's Pfizer or whatever brand, JSK. They are good brands, but what happens from the port to the time the patient needs it? This is a new story we should start thinking. Policymakers should start thinking. We cannot make progress in our drive for improved health if we don't think seriously about how our medicines are stored. Thank you.